Arizona Congressman Shadegg joins us now from the Capitol. Good morning to you, sir. We should mention that you're a member of the Health Subcommittee. In the early hours of this morning, we saw the Ways and Means Committee pass a health plan amongst that committee. Just while we were getting ready to talk to you, and excuse me while I look at my computer, the House Education and Labor Committee has voted and approved a health care plan. Are Republicans in Congress going to be able to slow this thing down or no?
Only if that's what the American people want. I mean, you're now seeing the most sweeping piece of legislation to face this country in at least 2 decades, maybe longer, be allowed less than 24 hours markup, less than 1 day markup in 2 of the 3 committees it goes before. House Ways and Means, as you mentioned, finished about 1:30 last night in the dark of night. House Labor finished this morning at 6 a.m. I don't think we're letting the American people know what's in this bill. The Democrats have such vast majorities, they'll stuff this bill down the throats of the American people if people let them.
It does seem like there's an awful lot of voting going on while Americans are home asleep. But let's talk about a plan that you proposed. You and some of your Republican colleagues have come out with a plan that's called the Improving Health Care for All Americans Act. How do you pay for that?
Well, most of it would be paid for with cost savings. What it really does is it says we're going to reform health care from the bottom up, and we're going to only change the things in our health care that need to be changed. For example, 83% of Americans who have health care are happy with their health care. My bill, unlike the Senate and House Democrat bill, lets Americans who have a health care plan they like keep it. The Democrats' bill takes it away. So we have to deal with just the rest of the American people, and by giving them a tax credit, which we think we can pay for substantially with savings from spending that's going on right now, we'll have the ability to cover the difference between the people that don't have health care now, which is what we're really worried about.
And we were just showing a graphic as you were speaking, sir, that talks about that tax credit that you mentioned, $2,500 for individuals, $5,000 per family. But I went and looked at what it actually costs for health insurance for individuals and, say, a family of 4. And on average, according to the Henry J. Kaiser Family Foundation, the costs are a lot more than the tax credit that your plan offers. The annual premium for an individual, $4,700. The average for a cost of a family of 4, $12,700. There's a big gap between what it actually costs and what your plan offers. So how are people supposed to make up that difference?
Great question. Number one, the figures you have are not the figures I have. The figures I have show that the cost of an average American plan is about $2,600 for an individual, $5,800 for a family. We're willing to be flexible with that number. I don't think it's as high as the number you just gave, but let me tell you, this is the key to the whole problem. The whole problem is cost, runaway cost. The president has said, and others have said, the rate of the increase in healthcare spending is unsustainable, and I agree with that. But why is that cost so high? And the answer is there's no healthcare marketplace. You and I can't exact savings by shopping in the market for healthcare insurance like we do for auto insurance or homeowners insurance or renters insurance or life insurance, or for that matter, like when we shop for a car or a refrigerator or a suit or anything else in our lives, because the tax code says that if you and I buy health care, we have to pay 1/3 more. We have to pay for it with after-tax dollars. My bill fixes that and says every American would be able to use before-tax dollars to buy their health care plan. Now the health insurance companies would have to sell to all of us. Right now, they just have to sell to our bosses, and our bosses don't know what we want, and our bosses don't know how much we're consuming. We have no downward pressure on cost right now.
I am struck by the number of Republicans. There seems to be agreement, Republicans and Democrats. Everybody seems to think that something needs to be done to reform health care. But is there really a way to do it, sir, honestly, without raising taxes?
Well, I guess, to be honest, nobody knows the answer to that question. But right now, we are spending a fortune in hospital emergency rooms where we pay for free health care for everyone in America who can't pay for their own health care. Instead of having that happen in a hospital emergency room, why not have it happen by giving them their own money and letting them buy a policy of their choice? And when they buy a policy of their choice, they can demand a policy that fits within their budget, and will force the insurance companies to compete. Right now, health insurance companies don't have to compete for your business or my business because we can't buy health care in the current system.
Very interesting points, and certainly something that we'll be watching very closely, as will you, Congressman John Shadegg, representing Phoenix in the Capitol. We appreciate your time, sir. Thanks for being here.
Thank you.
Well, a second.